All right, I got something for you. Ready?
Okay. Yep.
So would you agree or disagree? 99% of ENT patients don't need a hospital for their care. Does that sound about right?
I'd say that sounds about right.
Roughly. You could
Roughly.
say 98, whatever, 97,
Yeah.
somewhere in that.
Let's call it like inpatient where they have to stay the night or multiple days or something that way.
Yeah, or a hospital as part of their care, let's just say that period.
Fair.
And yet, so we're here in Milwaukee. In Milwaukee, 99% of ENTs are employed by hospitals and hospital systems. How do you jive those two things? Does that make sense?
It does not make sense.
It is.
Yeah.
How can our current reality not make sense in the healthcare world? How is that possible?
You know, I mean, I think a lot of power was given to hospitals to grow and expand and therefore gobbled up independent practices
Why?
because they can consolidate all of the care and charge hospital rates.
How does that help anybody?
It
other
doesn't
than
help
themselves?
anybody. Yes.
Exactly.
It does not help. It does not help patients.
So I guess so speaking for our little teeny piece of the world, our ear, nose, and throat part of the world,
Yeah.
what we just said is hospitals add pretty much zero value to the care you're going to receive, unless with certain exceptions. There are exceptions to that
Absolutely.
rule, but
Yeah.
certainly if you are going to have your septum repaired, you could, well, let me go this way. If you're going to have your septum repaired, the septum is the thing that divides your nose into two sides, left and right. You could have that done you could take your pick here. You could have it done in a hospital outpatient department, an ambulatory surgery center, potentially an office. So that's an option nowadays sometimes. So why would you choose any of those options over, one over the other? What value added? Why would you, if you're going to have your septum done, why would you possibly have your septum surgery done in a hospital?
I would say if you're going to have anesthesia and you have a lot of other health issues, right? So that really is the only way to justify it. If there's some concern for a complication with anesthesia, okay, a hospital might be a safer place to do it.
Yeah, I hear you.
But you could say the majority of patients don't have those situations. And even if they do have, high blood pressure and other things, you can still do those safely in a non-hospital setting.
Yeah, well, when you say the majority of patients, I'd say for folks who are concerned enough about their septum that they are thinking about getting it taken care of, they're probably not, clasping their chest in
Right.
the midst of a heart attack.
Right.
If you're having a heart attack, you're probably not so concerned about your septum.
I wouldn't be, yeah.
Correct? So I'd say most people who are going to have to get their septums taken care of are pretty much, not necessarily the sickest of the sick, but I would give you that. I think if there's a good medical reason to have your septum done in a hospital, then do that. But I go back to that 99% is an easy number, and I'd say 99% of the time that's not the case. That's
Right.
probably even higher. I'd say it's probably higher than 99% of the time where it's just no value added. And yet, in Milwaukee, if you're going to have your septum done, the most likely place you're going to have that done is in a hospital. And we talk about insane from a medical billing standpoint. That's insane. That doesn't make any sense in the world.
Well, and why is that?
Why is that? But
It's because it's going to cost exponentially more for no value add.
Yeah. Well, how
No
could that
value
be? How could something cost more with no added additional value? How is that possible?
It's because there's a lot more overhead to run a really fancy hospital than there is to run a surgery center or a clinic.
Yeah. But
There's a lot more administrators that need to get paid and everything else. We could get really into the weeds here, but as far as the value add to the patient, there really isn't any. And then, as a patient, I've been a patient myself, and I've had surgeries done. I don't want to be in a hospital unless I have to be in a hospital.
why? Hospitals are safe, man. They're the place you want to
Because
be.
hospitals have sick people.
Right.
And if you're having elective surgery and you're not sick, you don't want to be in a place where people are sick.
So to say that if you're a healthy person, the last place you want to be is in a hospital.
Correct.
If you're a healthy person wanting to take care of your nose, the last place you could possibly ever want to find yourself is in a hospital, because that's where you get, that's where sickness finds you.
Right.
Let me go another direction. If we're kind of going off topic here, but you heard of the coronavirus?
What's that?
The coronavirus.
No,
Yeah,
yes.
you heard.
Yeah.
Do you want the coronavirus?
I absolutely do not want the coronavirus.
You know how you get the coronavirus?
Go to a hospital.
Go to a cruise ship with somebody who has a coronavirus and hang out there.
Right.
because when you look at that, the data there, you see China,
Yep.
number one. The country number one on the coronavirus list is China, and number two is the cruise ship that had the one person who had coronavirus. I'd make an analogy to a hospital is, not that if you have coronavirus, please go to a hospital and get treated. So I'm not saying that.
Right.
But what I am saying is, if you don't have those sorts of things, and that's just it's a bit of an absurd example, but it's not, because hospital-acquired infections are real, and the part of those things that you can avoid is the hospital part. It's absolutely real,
Right.
And yet the entire system is flipped, completely on its head, where the only way for folks to get access to many medical services is through a hospital, and the only way that those services are going to be provided is in a hospital. And well, how can that be? Well, if you flip around what we said before, and this is actually a low stat, but if 99% of ENTs are employed by a hospital system, then the only way to get access to those are in a hospital. And that sort of, I don't know what the technical definition of a monopoly is, but if that's not a monopoly, I don't know what is.
Right.
And so what do you get there? You get a lot of people who are whose interests are aligned together against the interest of little old patient who's trying to get taken care of.
And those surgeons, they have no other place to operate because they're employed by the hospital system. So
Correct.
they say, here are your operating rooms.
Right.
And they're not involved in billing or anything else.
Nope.
That's all the administrative staff. And so that's where they operate because they have nowhere else to operate.
Right.
And we've had this discussion before that on the 99%, I'd say the overwhelming majority of surgeries that are done in the United States, operations that are done in the United States, are elective. Now, that's not cosmetic, okay? They're elective, meaning that they're still covered by insurance, but that you don't necessarily have to have them done.
Right.
Now, out of the overwhelming elective surgeries or operations, most of them could be done where you don't have to stay the night in the hospital, or maybe you do, but it's less than 23 hours,
Right.
or 24 hours.
Absolutely.
Right, and so therefore, all of those shouldn't be done at a hospital,
Right.
or most of them.
Absolutely. Yeah, I mean, it's basically, conceptually, you're taking same surgeon, if this is a true surgery where somebody's asleep, same surgeon, same anesthesiologist, different facility, same outcomes, better outcomes, because you don't have to worry about
Lower infection rates
lower
and things like
infections,
that.
all
Right.
those sorts of things. It makes all the sense in the world, but the system isn't
Right.
controlled by little old us or little old patient. The system is controlled by the big boys, the big Goliaths in the world control things, and that doesn't work really well from their vantage point. And they'll talk and they'll say they'll talk around the concept of, here's what I'm saying is, if you have a septum that needs to be straightened and you have the choice to do that in a setting other than a hospital, do that.
Mm-hmm.
And the counter argument is about, well, all the value add that a hospital adds for the population in general, and yet if it's your septum, it really doesn't impact you in a positive way at all. It doesn't mean that there shouldn't be hospitals. It just means hospitals should do what they do, and surgeons and surgery should be done in places where it makes the most sense, without any question.
And we shouldn't be wrapped up like the rising cost of healthcare, which is massive in our country. We don't need a 3-star Michelin restaurant in our hospital, or like 5 Starbucks. Those kinds of things that that are shown as value add are just not for patients. And they just increase the cost of care. And that septum that's done at that outpatient surgery center that costs half of what it costs in the hospital, it's no different. The procedure itself and the outcomes arguably could be worse in a hospital
Correct.
than a surgery center.
Yeah, and then next level, now I'm going to blow your mind here. I think you already had this blown, but if you take that septum that's bent that you want straightened, is that what you're saying to me? Are you saying I've got a septum that's bent that I want straightened? Or are you saying I want to breathe through my nose and I want my nose and sinuses to work properly?
I want to breathe through my nose.
Correct. So if you want to breathe through your nose, lo and behold, a lot of times we can leave that bent septum alone and we can gain space around it in the office. Now that's like next level thinking. Nobody would ever deign to think that that's an option in 2020. No way. That you could take somebody who's on a one-way pathway towards surgery in a hospital, which is ridiculous, and save them from that, bring them into an office, leave your septum alone, gain space around it, get you what you want. What you're asking for is, I want to breathe through my nose, and what we're going to do is we're going to let you breathe through your nose. we don't need to put you to sleep to do this. We can
Right.
do this in a very, relatively quick and elegant procedure and have you up on your way. And if you have that choice, and most people do have, well, most people, that choice is there in the world for people. Most people don't know they have that choice. And so when we, talk with patients, we're talking them through, it is with the recognition and acknowledgement of there's all sorts of versions of getting somebody moving forward. There's sort of high intensity, relatively low yield for what we're putting you through, to low intensity, high yield. And most people are really looking for a problem that they want fixed, and
Right.
our job is to fix it. And the nice thing is, well, I don't own a hospital. Do you own a hospital?
I do not own
So
a
I don't
hospital.
really have a skin in the game as far as a hospital, sort of getting its cut of whatever it is that it's supposed to get. I don't care. It doesn't matter to me.
Right.
And so if you don't own a hospital, then your interests are more likely to be aligned with the patients that you're treating. If you do own a hospital, then good God, man, you've got a lot that you need to pay for. The hospitals are expensive,
Yep.
and expensive things need, it needs money to feed it. And so, thank God we don't own a hospital. Thank God that's not part of who we are. That's a good thing. It's sort of this, at the end of the day, for what we do on a day-to-day basis, the nice thing is the tools and the setup that we have are completely tailored for the people that we're treating, not for the people that are, sort of, not for people that we're not treating, I guess. At the end of the day, a hospital is built for pretty much, if you have ENT issues, hospitals are built for everybody else other than you. If you have an ENT issue, you don't need a hospital for
Right.
the majority of patients.
Right. And question for you. How many patients who have their noses looked in, by whether it's an ENT or somebody else that looks in there, how many of them will probably be told they have a deviated septum?
Oh, quite a bit. Quite a bit, although I would venture to say there are more people who are told that they have a deviated septum by somebody who actually wasn't able to look in their nose.
Sure.
Does that make sense?
Yeah, absolutely.
You follow the ball. Because not to knock every other person in medicine, but it's short of an ENT looking in somebody's nose, I don't necessarily trust the information I'm getting. If
Sure.
an ENT is looking in there and they say you've got a deviated septum, you probably do. And on that metric, I'd say the majority of people walking around in the world have some degree of a deviated septum.
Correct, right? So yet it is always kind of talked about as, oh my gosh, I have a deviated septum. Like, I know I have one. Or how many times have patients come in and said, hey, I know I got a deviated septum, I don't breathe well. And in their minds, they're already connecting the dots about what they need to have done and what's causing their problem.
Right, absolutely.
And then we have to say, or I usually tell people, like, everybody's septum is deviated. It's just a matter of how bad, right?
Sure.
So it kind of just reshifts their mindset there.
Yeah. Generally, and although I'd say, go back to what I was saying before, if somebody's having their nose looked at almost anywhere, it's because they have an issue going on there that they were wondering if, can it be corrected? Can I do better? That's really, again, back to the question they're asking is that, and the answer that often is given is not the most effective way to treat or answer the question. The question is, I want to breathe better. Your septum may not be helping you, but there are likely other things that aren't helping you either, and it may very well be better to start with those other things that we can treat in a lower intensity manner and likely save you from maybe even need to get that septum taken care of in the first place. So.
And having it done in a hospital.
Right, which, and again, nothing, back to now, on the hospital front, I'd say I don't have anything necessarily against a hospital.
Right.
I trained in hospitals.
My wife works in a hospital.
Hospitals are generally, they're good, but hospitals are for sick people, and that's what they're built for.
Right.
And you shouldn't take a healthy person and put them in a hospital because you're going to get basically, if you put a healthy person in a hospital, you're going to take that healthy person, and you're more likely to make them sick than healthy.
Absolutely.
That's not a game that anybody wants to play in. And if you have a choice, you would make that choice. Unfortunately, most people don't have the choice. Most people are told what to do. Most people don't understand that they are actually in the driver's seat. So if you're a patient seeking care out, you're in the driver's seat. Nobody can tell you what to do or where to do it. You can state your case and you can make it so. I think a lot of people don't even know to question or ask questions or question authority or just question.
Yeah.
Questions are good. Questions are good, and answers are good when they are matched up with the questions that are being asked. And I guess that's a simple thing. If you have an ENT issue, why, in God's name, do you need a hospital? And the answer is likely you don't.